All right. I think we'll go ahead and get started today. Hello, everyone. Welcome back from the long weekend. Russ is not able to make it here today. They had a lot of ice storms, snowstorms in Washington this weekend, so he unfortunately does not have any power or internet at the current moment. He's hoping to call by phone later, but just want to give you that heads up. But we do have today Dr. Katie Richardson and her associates with Bright by Text. I'm going to introduce Katie here. So Dr. Katie Richardson is a board certified pediatrician and experienced healthcare leader. She's attended the University of Colorado School of Medicine and did her residency training at Children's Hospital Colorado. She spent the majority of her career caring for patients at Kaiser Permanente and left in 2019 to explore more entrepreneurial endeavors. Dr. Katie joined Right by Text as CEO in early 2023, so just last year, after serving on the board for the previous 5 years. With her today is Leisha Andersen of Right by Text's content team. So Dr. Richardson, if you'd like to take it away, you can go right ahead.
Thanks so much, Justin, and thank you to everyone who's here today. And Dr. Leisha Andersen, who again is with me from Bright by Text. She's also a pediatrician and has been in the Denver area for many, many years working on behalf of kids and families. So I'm not sure how many of you are familiar with Bright by Text, so I am going to go ahead. Actually, hold on just one second, because for some reason my presentation isn't up, but I'm going to go ahead and do a brief presentation, then we'll have time for questions. And then Justin, just out of curiosity, will you let me know how much time do we have total?
So you have 45 minutes, give or take a little bit. We won't cut you off right at 45, but around there.
Well, I'm going to try and do a brief introduction of Bright by Text then, and we look forward to taking your questions. And Dr. Leisha, don't hesitate to jump in at any point if you have anything to add. And if you guys, you don't have to wait till the end to ask questions either, but I'm going to try and go pretty quickly through the overview. For those of you that don't know what Bright by Text is, I'm going to give you a little history. So we essentially began in 1995 as Colorado Bright Beginnings, and we were brought together by Procter & Gamble Chairman Brad Butler and then Colorado Governor Roy Romer to make Colorado the best place to raise a child. And we started as a home visitation program. Between 1995 and 2014, we really had continued to grow and expand the work all over Colorado and had a name change to Bright by 3. So some of you may recognize that if you've been in the Colorado area for a while. Then in 2014, we essentially took all of the content that was created for these home visitation programs and transitioned them to text messaging, created a homegrown text messaging platform. And at that point, not only set on a venture to increase the parents and caregivers that we could deliver this content to in the state of Colorado, but transition to a nationwide service. In 2024, as you can see, we are currently serving all 50 states and are coming very close to 150,000 parents and caregivers nationwide, which is super exciting. Over the next couple of years, and actually we have an audacious goal in 2024 to actually expand to reach 500,000 parents and caregivers nationwide. We are currently available in English and Spanish, but we are working to expand our languages in the coming years, as well as really personalize our content and be more on demand. Although our vision essentially is that it's every child's birthright to thrive, and we are here to support parents and caregivers in their parenting journey. And really, We provide education and resources, leading to more confident, competent, and connected parents and caregivers. So one might say, when you think about implementation science, why text messaging? Well, there's a lot of data that says it's a very equitable way to reach parents and caregivers due to the number of adults in the US that own a mobile phone. We also know that text messages are opened and actually responded to very quickly in comparison to email, which oftentimes never get opened. And so we know we have a higher open rate, and we are reaching families not only by the data that we collect, but also by data that is out there already. So that's why text messages. So our program, essentially, parents and caregivers can text and a unique keyword. We sent a few of them in the information that was sent out to you all if you wanted to take a look at our program, to the short code 274448. Our community partners are able to create their own customized keyword to promote this service to their subscribers. We ask for 3 pieces of information. So either the child's or a parent's due date for their child, or the child's date of birth, what their zip code is, and then whether they want to receive messages in English or Spanish. So this gives you a pretty good idea of our very simple sign up process. So the types of content that we deliver, we have 3 types. One is age-based content, and this content really is delivered in line with a child's age and stage of development. So specifically to age of life, or prenatally to second trimester and third trimester. And we have messages really that encompass many topics around health and safety, overall wellness, mental well-being, developmental milestones, brain development, social emotional development, and more. There's an example there at the bottom of an age-based message. We also have topic-based area based on families' needs or interests. And these programs are programs that parents and caregivers can opt into. So sometimes we talk about our opt-in content. So several of those, including talk, information for families who have a child with a suspected or confirmed speech or language delay. Cook, which delivers healthy, low-cost, family-friendly recipes. Bond, which really is an early relational health program we'll talk about more later. Math, which is early numeracy and math games. And then one of our newest programs is called Meal. I'm going to talk a little bit more about that later as well, which is all about nutrition education and resources for families and caregivers that are struggling with food insecurity. And then our third type of content is our location-based content. And this is why we ask for zip codes. So we partner with, for instance, probably more than 60 partners in the state of Colorado alone. And those partners actually submit and or enter messages into the back end of our system about free and low-cost local events and resources. There are some examples there: food banks, diaper banks, health fairs, immunization clinics, library story times, museum, free days at the museum or the zoo, etc., disaster aid relief, just to name a few examples. As I mentioned previously, we are prenatally, so second and third trimester, and go through the end of the 8th year. I will mention, though, we are going to be expanding our content. Right now, our community messaging, so our location-based messaging, does go through the age of 18, and we will be expanding our age-based content and our topic-based content to more ages above the age of 9, so 9 to 18 in the coming years, mainly focused on, one, a partnership that we have with Common Sense Media related to technology and screens, as well as mental health will be a big part of that 9+ curriculum as well, as we know that's a big area of focus. We take a whole child, whole family approach, and this gives you an idea of the types of messages that we are sending. I'll let you just take a look at that quickly. We also wanted to include this because it talks about how our messaging is really supporting social determinants of health. So 2 areas here, again, the age-based content. This gives you an idea of the types of messages in each of the social determinants of health areas that we would send, again, based on a child's date of birth or mom's due date. And then similarly, location-based messages that are also in that related to those same social determinants. We can send these along later because I realize you're not going to have an opportunity to read all of them, but it just gives you an idea of the types of messaging that we are putting together for our parents and caregivers. We work, as I mentioned, Dr. Leisha, as part of our content team, we have a curated content library from trusted experts. So all of our content, almost all of our content, is created in-house. But what we pride ourselves on is really partnering with nationwide experts in early childhood and other areas of child development to create the types of content that we are looking for. So the text messaging, again, is often created in partnership with these experts. And then sometimes that will link to a landing page that might be on our server. So we may have created that, or it might link to a landing page, say, that's on Common Sense Media's server. So it might be additional content that they have provided. And again, there is a complete list of our national partners by either, if I send this along, for you to click there, or by looking at our website. So what is the experience like for parents and caregivers once they've signed up for Bright by Text? Well, they will get anywhere between 2 and 5 messages a week. Clearly, if you have more than one child, you're getting a few more of those age-based content messages. We also are more content heavy, I would say, in the prenatal through the age of 3. A little lighter on the age-based content between 3 and 5, and then between 5 and 9, again, a little lighter, as we know that parents need a little less support in those times. But this gives you an idea that the text message comes through. They all have a link, unless they are just a simple message of encouragement, which we often have those as well. They link to a landing page. This gives you an idea of, it talks about the activity. It often has a video. And then we also, at the bottom of these pages, link to additional content. Again, this gives you an example of a national partnership with PBS, where the additional content is linked on one of their websites. One of the benefits that we have with having our own system is the ability to be able to track impact. So how many parents and caregivers are we reaching? How are we doing with our messages? What is the click-through rate of these messages? And we have the ability to reach out to parents and caregivers to know whether they are utilizing the services and resources that we are putting out there. So this gives you kind of a picture of what our dashboard looks like internally, but I also put some numbers here. As I mentioned, we're getting dangerously close to 150,000 parents and caregivers. Those parents are caring for 183,159 children at present day. This was from today, maybe yesterday. And in Colorado, we have over 18,000 parents and caregivers on Bright by Text, and they are caring for over 21,000 children. We do know by a couple of overlays that we are able to put on our data, as well as the fact that we do survey our parents and caregivers. And so we'll talk a little bit about that further on in the presentation. But with our overlay data, we know that just over 50% of our parents and caregivers live in low-income zip codes, and about 13% live in healthcare provider shortage areas. We also know that, just as a matter of Colorado data, 8.3% of Colorado subscribers get their messages in Spanish. So a smaller Spanish speaking following, but that number is 7.3% nationwide.
Dr. Richardson,
I
have
want
a question
go for it.
about
Yes.
on the prior slide when you said the 50%, the Colorado, they were in low income, et cetera. Is that just kind of how it happened, or do you all target particular folks for your programs?
So I'm going to say
yes, ma'am, those.
Yeah. I'm going to say it's both. Certainly, we get a lot of word of mouth transition of folks signing up for Bright by Text, but I would say the majority of our partners are targeting families that are in low income areas and have high needs, because we know that not only is the educational information helpful, but a lot of the resources that we deliver are directed at that population as well. Does that answer your question?
It does. Thank you. Yeah.
Yeah. Any other questions? All right. I'm just going to touch on a few of our, so as I mentioned, our topic related areas. We have a few that I think are kind of related to healthcare. The first of which is BOND. And this program was I'm going to say launched in about March of 2023. And really, this program is for parents and caregivers who have had an infant between the ages of 0 and 1. It is a 6-month program where they get one message a week, and those messages are around the themes of parent and infant mental health, and under the guise of how to better bond with your infant. We send lots of encouragement because we know that this is a particularly hard time for parents and caregivers, and we're also connecting them to resources. So this is an example of one of the BOND messages that is sent out, and I can share with you many more if you'd like to know more about it. We currently have 2,300 parents enrolled nationwide in the BOND program, and we've started to get data. We have not yet done a formal write-up of our data, but what we know is over 90% of those who opted into the BOND program believe that the messages are really helpful and are helping them feel understood and seen as a new parent. We also know that 96% of the survey respondents indicated that these messages have inspired them to take at least one action. So again, those are snuggling, playing, or spending quality time with their infant, taking time for self-care, which we think is important, sharing the program with friends or family, talking to friends or family about what their needs are. 41% have said that they contacted their baby's healthcare provider as a result of one of their messages. And then talking to friends and family about their infant's needs or contacting their own healthcare provider. We also know that at least 20% have contacted one of the helplines or resources that were provided. And again, the majority of those are really directed at parent and infant mental health resources. A second program I just want to mention is our newest opt-in program called Meal. So this, again, is for parents and caregivers who are experiencing food insecurity. And this was just launched in September of 2023. We have an HFDK grant that helped support the creation of this program. We have many partnerships through HFDK to get the information out about Meal. But again, we have some nutrition education content. We really are looking to expand awareness and enrollment in federal nutrition programs and connect parents and caregivers to healthy food events and resources. Here is one example of a Meal message that has been sent out. We currently have 1,269 Colorado parents enrolled. I would say, I think probably half of those are in Denver City and County, which actually is the area of interest, not only for the grant, but for the pilot program. Somehow we also have, again, through word of mouth, several hundred parents and caregivers that are outside of Colorado that have heard about this meal program and are hoping to get resources. We know just by the growth that we've had in the program since September that there are lots of parents and caregivers that are interested in getting information on these resources. We only have data so far from a baseline survey, but what we know from that data is just under half of those that filled out the survey are already participating in WIC or SNAP. And two of the biggest barriers to getting resources are, one, lack of knowledge of who offers food supports in their community, and the second is lack of knowledge about eligibility criteria. And once we're done, I'll let Leisha talk a little bit more because there were a few other topics that came up from our initial survey that really helps us understand what else do we need to be putting out there as far as resources go that really relate to food insecurity, but may not have been on the forefront of our minds when we were putting this program together. The third program I just want to mention is called Tough as a Mother. And this was a partnership with an entity here in Colorado, again, called Tough as a Mother. If you're not familiar with it, it is a program for mothers with addiction and or substance use disorder. And the themes of this program, again, an opt-in program. So far, we have only sent one message in the state of Colorado only to our 18,000 parents and caregivers. And we got 51 parents enrolled after a single message. But essentially, Tough as a Mother is managing the messaging of this content, and it's really around education. There's lots of encouragement for these parents and connection to treatment resources and support groups. And here's an example of the message sent from Tough as a Mother. I want to go a little bit more briefly into our impact. So I mentioned at the outset that we are looking to improve confidence of parents, competence of parents, and connections. And when we think about connections, it's not only improving the bond with children, but also connection to local resources in the community. So we survey all of our subscribers at 1 month and 6 months of receiving messages. So no matter when you join at 30 days and then at 6 months, you receive a survey from us. I will tell you, our survey results tend to be in the 2 to 3% range of response rates, unfortunately. So we may want to talk about how we might increase that. But this gives you an idea of what we're finding as far as subscriber reported benefits. We have done a couple of what we called quasi-experimental evaluations in the past. Some work with Marzano Research really looked at the benefits of Bright by Text, finding a 3-month language gain among low-income Bright by Text families compared to a control group. 56% increase in awareness of local resources from a Bright by Text community message, and really high likelihood to recommend. So 97% of respondents said they're likely to recommend this program to a friend or family member. We also did a more recent study looking at outcomes for our more under-resourced families. So again, we looked at disaggregated data and our subscriber demographics, and we found that our Hispanic and Black subscribers reported statistically significant stronger outcomes in terms of behavior engagement, connections, and confidence when compared with white subscribers. And then we also know that our lower income subscribers, so households earning less than $50K per year, also reported statistically significant stronger outcomes. So those were good. I will tell you, being honest, I was on the board during this time, and I know the outcomes were not, from this particular study, were not as strong as they had hoped, but this is what they were able to glean from the data. So I'll go ahead and stop there and open things up for questions. I know that was a whirlwind tour of Bright by Text, but before we jump into kind of what the reason that we wanted to be here today to pick the brains of experts like you all, we had a few questions that we came up with, but I'd love to hear questions and comments from the group first. And I can go ahead and stop sharing. Any questions about?
I'll
go
jump
ahead.
in. Yeah, no, great presentation, and trying to kind of grasp the pieces and parts. Always when I'm thinking of implementation science and initiatives like this, I'm thinking, how much do we already know the evidence is there versus we need to improve the evidence further, and also, how good is the implementation? Where are the places to look for improvement? It seems like there's a good deal of evidence already on certain fronts, but also opportunities to develop more evidence. And we're always also thinking about, like, what are the core functions of the intervention? And this has a lot of functions, it seems, and I think I would try to think of segmenting maybe some of them to decide which partners to work with at which time. I'll just give that brief example from what I put in the chat. We're working with, one opportunity would be NHLBI has pushed this big initiative on maternal mortality and having better preconception counseling and prenatal counseling for parents to improve birth disparities, right? Maternal mortality and other perinatal disparities. That's one segment of the lifespan. You cover a huge segment, right? But there are several, centers that have just been funded to do this type of work, and it's in service to health equity. There could be different community partners that might have different messaging they think could be useful for their particular populations they work with. And it might be one segment of what you do and not all of them. So
Yeah.
I'm just highlighting that as one bit. And then, I always like things like an implementation research logic model to help think about how we could improve certain outcomes like reach or adoption. So if you haven't already engaged in developing something like that, we could give you resources. Our colleagues, Borshka Rabin, they have a logic model on their disseminationimplementation.org you can look at and think about, like, what does it seem like the contextual factors are that are getting in the way of things like reach or adoption, and then help think through, particular strategies, approaches to work on those things. So I'll stop there. I'm sure lots of other ideas are popping in the crowd.
Thank you, Amy. Just to answer a couple of questions, we have been in several conversations with Dr. Monica, but I would say one of the biggest things that in my mind, actually two things that I think we are lacking as far as the data goes. We do have some data. We have a lot of subscriber reported data. I think the two areas that not only are we hearing from funders, but as I look at the data that we have and are thinking about, okay, how can we strengthen the data? There are two areas in my mind. One is evaluating how we're doing with improving kindergarten readiness, because our focus really historically has been in the early childhood space. Can we look at, people are asking us, well, how do you know that you're improving kindergarten readiness? Well, we don't really at this point know that that's the case. I think the second piece of it really is, I talk about, I think my team's probably tired of hearing me say it, but about closing the loop. So we put a lot of information out there about resources. How do we know that we know how many parents and caregivers are clicking into that message? We know that they may have even gone to an additional website. We can track that piece of it. But how do we know that they actually got signed up for WIC as a result of our message? How do we close the loop on even developmental screening? So they decided maybe their child has a concern. How do we know that, again, that they took the next step to make a phone call to get evaluated and that their child got services? So I think that's the second area. As we make connections to resources, that idea that we are actually, how can we better close the loop, but also measuring that we are closing the loop and that people are actually getting to the resources that they need. Those are the two areas in my mind that I think we really need to take a deeper look at. And then as far as the maternal or perinatal disparities in mortality, certainly, and I shared really the tip of the iceberg about our bond program. But since this has come out and really reading through the impact that is made on these parents and caregivers that are enrolled in the program, I absolutely agree with you that I think looking at how we can incorporate that into more of the work that's being done in perinatal to improve perinatal disparities and maternal child mortality around childbirth, I think would be amazing. We would be excited to participate. So, other comments?
Well, and I was going to
Questions?
say, Amy just made the mention in the chat box about whether or not there are potential measures for kindergarten readiness to use as a way for us to measure as well, which is always what we're keeping our eyes out for. Where are the measures that we can get the evidence? I was going to add that Katie alluded to this earlier, but something that is unique is that with our surveys, we're getting information back from the participants of our programs. And that has been really nice from for the meal opt-in program, that we've gotten some information back from the families. It makes sense, some of the information that we received, it just wasn't sort of top of mind when we were developing the content. The content we really were focusing on giving people, very specific information about food security. But the questions, a lot of the questions we're getting are families wanting more information about public charge, families wanting more information about just general economic security. And so we are flexible enough that we can, tailor the programs. And so we're going to add in some messages about, EITC and other things that families could do to potentially increase their financial security that will make their food security situation hopefully improve as well.
I see a couple of questions just looking at the chat. We are not, to my knowledge, connected with Rosie, but thank you for sharing that, Katie. And question about where does our funding come from? So we are a 501c3, but I would consider us more of kind of a social enterprise model. So Right by Text will always be free for parents and caregivers. Always, always, always will always be free for parents and caregivers. But what we do is partner with, again, larger community organizations, again, for them to access the ability to put messaging into the back end of the system, et cetera, et cetera. They actually pay a licensing fee to be able to contribute to our local community messaging. That being said, because I think many of you are here in Colorado, for local Colorado partners, like I said, we have probably close to 60 at this point. That is funded by the Colorado Department of Early Childhood. The state foots the bill for all of our Colorado partners. So we have some state contracts as well, but we partner with a lot of United Ways. We partner with a lot of PBS stations across the US, healthcare entities, library systems, all those areas that are really interested in improving early childhood, early literacy, early childhood health, et cetera.
And Heather, I want to address your question in the chat box, which you're kind of reading our mind. We're testing out, we've always had surveys as part of Bright by Text, but with the meal program, we're testing out a new program for trying to see if we're closing the loop, that families will get just a kind of a one question after they get a connection to a service. So let's say they get a message about connecting to WIC. Then we're following up with just one question. As a result of this message, did this help you connect with WIC? And so we're testing that new kind of a new approach to doing these one question surveys as a way to help out. So just wanted to address that.
And I did see Claudia ask the question around, is all the content driven by partners, or is there some potential for AI and machine learning to create curated content? So we are a couple of things. One, you all are probably having fun with Chat GPT, like I'm having fun with Chat GPT. And I asked Chat GPT about how to help my 2-month-old sleep. I have, by the way, a 19-year-old, not a 2-month-old, but I like to, as a pediatrician, I like to ask questions like this. And Chat GPT told me that they could lay on their stomach or their back or their side, and went through all of these different things. And I came back and I said, wait a minute, I thought my infant wasn't supposed to sleep on their stomach. And then they came back and ChatGPT said, oh, you're right. In, whatever time, the American Academy of Pediatrics, made a recommendation based on blah, 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 and, went on and on. And so although we are in the next 3 years working to get what I would call AI ready, we are not, we are an evidence-based content company. We have oversight of all of the content that is created. Clearly, we follow American Academy of Pediatrics guidelines, among other national experts. And so we're not ready to dive into that pool yet. What we are looking at over the next 3 years is to take the content that we have, make it more personalized and more on demand. So how can we take our container and apply AI to the container of information, our curated content that we've already put together, to deliver that evidence-based information on a more on-demand way, in an on-demand way, but really making sure that the container that we're using is information that we know is good information, if that makes sense. Other questions? I'm going back through.
I just want to ask Katie, are we addressing your key questions? Because this group is really good at giving you a brain dump, but did we answer your kind of core questions for us, or are there some you want to refer back to that maybe we haven't touched on?
Yeah, I mean, I think our big things, when someone just put a recent comment in about use of this tool in healthcare. And so one of the things that we've partnered certainly with local AAP entities, most, I'm going to say, practices. We've done some work with Children's Hospital here, and definitely in the public health realm, we've actually had a lot of connections. But one of our questions is, ideas on how we might increase reach and adoption in healthcare and other verticals. And then, the other aspect, I think, specific to this group, and I saw a couple people in the chatter like, we'd love to talk to you, which would be great. But how would a tool like ours or Bright by Text partner best with this Accords group? Because we do know you all are studying some of the things that we really want to make sure that we are reaching the right people, and again, that we're closing the loop. And then the other thing in my mind is really engaging other partners in research. I'm constantly saying, because I am, I think, an innovator, an entrepreneur at heart. I'm like, well, let's try it and see what happens. Try something new, because I think, those are the only way we're going to know is to try. So those are some of the questions that I would have. I'm not sure if folks have additional answers, and sounds like we have about 5 minutes. So I'd love to hear from a few folks if you have thoughts to those questions.
I'll put something in the chat with greater detail, but for the healthcare system, speaking as a primary care doc, but an adult, not a pediatrician, it seems like the drivers are really, the value propositions are around what gets measured for our quality metrics. So I think it really has to align what you've shown the evidence on with what are our drivers for quality metrics. Part of that's just because we have so little margin if we're getting incentivized for
Mhm.
certain metrics, anything we take on has to really connect with those directly. So I would just encourage you to think about for different healthcare organizations that are either family practice or peds, how that fits in. And Bethany Kwan's Designing for Dissemination course would be great for anyone, who wanted to go deeper into that. I'll just plug that.
Awesome. Thank you. Yeah, we have talked specifically with a larger entity. Florida AAP is thinking about bringing us to the entire state and them as the lead, which again would be a way to engage certainly healthcare providers for children in a much bigger way. But we talked about not only quality metrics, because we talk a lot about vaccinations. We know that that's important, but we could focus on the other things, the other quality metrics that are at the top of that list. And then we also talked about, and I'm not sure, again, I spent most of my career at Kaiser Permanente here in Colorado. And so we were a patient-centered medical home, but I didn't have to do that all on my own, which was awesome. But there are certain metrics related to patient-centered medical home that I think Right by Text can help support as well. And that's another kind of angle that we've talked about, supporting pediatricians and family practice docs in that arena. Other thoughts? Well, thank you all. Feel free. I know that Leisha put our contact information in the chat. We would love to talk more to any and all of you about our program, what we're doing, and how we might work together. But we really appreciate you all being here and taking the time to listen to our presentation today.
And we don't know much about how to do a formal D&I, consult, so let us know. But I did email you, Amy, per your request, so maybe we can connect on that again.
Sounds good. I'll put the link for it in the chat and also can put it in that email. Yeah.
Thank you so much.
Thank you.